Now it's time to talk about blood pressure, okay? And we're gonna, unfortunately, talk about some math first. It's gonna be very simple math, okay? So, so blood pressure. Now, think about it as the plumbing problem, okay? So pressure of fluid in your system, listen, pressure of fluid in your house, okay? It depends on two factors. How much water, how much blood is being pumped, right? And not just how much blood is being pumped, but how much blood is being pumped in a minute. So it's blood flow, right? So it's proportional to blood flow. And it is proportional to what we call a peripheral resistance. Okay? Let me explain what peripheral resistance is. Did you see like plumbing at home? Did you see it? So, well, so for instance, the pipes, the main pipes that go out of the water tank, they relatively wide. Does that make sense? And then they will become a little bit narrower as they go to the faucets in your sinks. Does that make sense to you? Now, if you will try to install really, really tiny little pipes, the pump that pushes that water will have to work much harder. Does that make sense? Another good example would be, listen, you drink through the straw, right? Regular straw is easy to drink through. Try to drink through the coffee straw. It's very narrow. Does that make sense to you? So that's going to be peripheral resistance, resistance to flow. Now, blood flow through the entire circuit in a minute, think of it, is equivalent to cardiac output. It's a definition of cardiac output. Blood flow through the circuit in a minute. So, essentially, systemic blood pressure is proportional to cardiac output and peripheral resistance. Does that make sense? Are we good? Now, what contributes to we already figured out the details about cardiac output. Now we need to talk about peripheral resistance. So what are the factors that increase it? So peripheral resistance is increased by, first of all, size of the body. When somebody is bigger, they have more blood vessels, right? More blood vessels means higher peripheral resistance. Are we clear? It doesn't contribute much. It's not a huge deal, but it is a little bit of a deal. So far, we good? Blood viscosity. More viscous blood leads to higher blood pressure. Okay, that makes sense? Higher peripheral resistance. Are we clear? For example, one of the sort of issues for people who use erythropoietin, which is illegal performance enhancement drug. Okay, erythropoietin results in more red blood cells, which makes blood more viscous, which increases blood pressure. Okay. Another is turbulent flow. Now, if you stand next to the river, okay, the flow, like you look in the river, on the water, right? And the flow looks like this. Everything is parallel. Does that make sense? But now imagine that you have a boulder in the middle of a river. And this is what you're going to have. Does that make sense? So this is turbulence. Are you with me? Like all those little whirlpools and...
So like a blockage of flow?
It's not a blockage. It's a little impediment, which changes how fluid moves. You see what I'm saying? Think of it this way. Look. What moves in the, like, kind of opposite but similar idea. Imagine that something is moving through the water. What will move better? A fish or a toy truck? Obviously a fish, because there is less impediment to flow. Does that make sense? Toy truck has all those little things sticking out. Makes sense, right? So clinically, flow becomes turbulent around plaques, so atherosclerosis, and it becomes turbulent at the branches. Now, you can't possibly prevent your blood vessels from branching. Does that make sense? So this is sort of an intrinsic thing that we don't really care about because we cannot do anything about it. But partial obstruction of a blood vessel with an atherosclerotic plaque not only changes the diameter, it also changes the dynamics of flow, the hydrodynamics. Does that make sense? So flow becomes more turbulent. You like make rapids over there. But the most important factor that contributes to the peripheral resistance is the vessel diameter. Okay, now we're going back. We're going back to the plaques and straws. So you can, if you ever tried to drink through the coffee straw, you know that it's really, really hard. And turns out that peripheral resistance is proportional. Hold on a second. I'm thinking. I think I'm right. Yeah. The radius or diameter, let's put diameter so it's going to be easier for you. The vessel diameter in the power of 4. Does that make sense? Now, why it is important? Imagine that you have some baseline level, baseline diameter of a blood vessel, right? Normal. For some reason, that blood vessel gets constricted by a half. Are you following me? So the new diameter is 0.5. Or, okay, 1/2. So you need to put 1/2 into the power of 4, and it's going to be 1/16. And it means that peripheral resistance, when diameter of a blood vessel decreases by 1/2, peripheral resistance will increase 16 times, which is a lot. Does that make sense? Are you following me here? Does that make sense? No? Look, quantitatively, it's just an illustration. I don't ask you to memorize this formula, God forbid. What I want you to understand, and this is pretty qualitative. The smaller the blood vessel, the higher the resistance. Does that make sense? Now, if you look at these factors, the only one factor that we can actually modulate, that we can change real fast, is the vessel diameter. Make sense? You can't regulate blood flow by, quickly altering blood viscosity. It's not feasible. It's not quick. Okay? But you can change peripheral resistance and you can regulate blood pressure. Does that make sense? Are we clear? Okay. Now, remember we were talking about sorry. We're talking about different blood vessels. How they like elastic arteries, muscular arteries, and arterioles. So arterioles are the smallest vessels. And this is the part of your circulatory system that has the highest resistance. Okay? So if you would want to demonstrate, like, on the graph, the dynamics of the blood pressure, you have the highest in the aorta, okay? Then it reduces in elastic arteries and then in muscular, and then you have that massive drop, okay? You have massive drop in this drop here, that's arterioles. The largest drop in blood pressure is in arterioles. Does that make sense? There are many of them, and they vary, and then relatively tiny.
So why, if they're tiny, would resistance be stronger?
Yeah, of course.
Why is blood pressure lower?
Huh?
Did you say blood pressure would be lower in the arteries?
It's not lower, it drops the most. Okay, so where does blood pressure, I should have started from this. Where does blood pressure come from? It's a resistance to flow. Does that make sense? So if there would be, hypothetically, no resistance to blood flow, there would be no blood pressure. It would just go without, like, by itself. Okay? So when blood goes through massive, big elastic arteries and relatively large muscular ones, it doesn't have a lot of resistance to flow. So let's say, where's the best place to measure blood pressure? Systemic blood pressure, the best place. Which part of the heart generates systemic blood pressure?
Or left?
Left ventricle, right? It pumps blood into where? Into the aorta. This is the best place to measure blood pressure. Right? Because this is the pressure at the exit. This is the actual pressure. Can you do it? No. You can't just take a probe and stick it into the aorta. Does that make sense? So this is why, where do we measure blood pressure? On the arm or on the leg, if for some reason arm is not available. So we measure it using the brachial artery. Okay? It's a pretty large artery, and we assume that we measure not this, but like here. Does that make sense? So is it going to be lower than in the aorta? Yeah, a little bit. What is the better place? Well, if you remember, if you studied anatomy, you will tell me. Apart from aorta, what is the second best place available in the human body to measure blood pressure? It's not this one. It's a tongue-in-cheek joke. What is close to the heart, closest to the heart, and kind of physically available? You can put a cuff on it. It's your neck. So ideally, you put a cuff on the neck, but by the time you're done, patient is done too, right? So this is the closest to the heart we can possibly get. This is why an R. Makes sense, right? So and what you have to understand about blood pressure is that blood pressure is generated by the heart, and this is the force that drives the flow. This is why blood is moving. Blood is always moving from the area with the highest pressure to the area with the lowest blood pressure. Does that make sense? So in the systemic circuit, the highest pressure will be basically at the entrance to the aorta, right? At the border between the aorta and the left ventricle. You clear? Where's the lowest blood pressure going to be? Vena cava, where vena cava comes into the right atrium. Does that make sense?
Is there the lowest?
The lowest. Technically, it's considered to be zero there. Okay. So basically, think of it this way. This is a slope. Okay? So your blood rolls on that slope. Okay? So far so good? It rolls pretty fast here, experiences the highest change in the blood pressure in the arterioles, comes out of the arterioles into the capillaries, okay, and then into the veins and postcapillary venules and veins. Does that make sense? The slope determines how fast blood flows. So in elastic and most muscular arteries, it flows fast, but not too fast. If you measure the blood flow in arterioles, it's insanely fast.
Because the tubes are smaller.
Because there is a gradient of pressure at the entrance and at the end. Does that make sense? No?
I'm confused because they're the smallest, so I would think that the flow would be like more restricted.
I understand where it comes from. Well, the rate of flow depends on the gradient of pressure. Does that make sense or not? How different the pressure on the opposite sides is.
So pressure of blood coming in from the aorta
Well,
is
muscle
higher than
compares.
the muscle or tissues.
Well, you have gradient in the elastic arteries, you have gradient in the muscular arteries, and you have gradient in the arterioles. Does that make sense? So the steepest gradient is in the arterioles. The difference at the start and the finish is the highest. Your slope is the steepest. So the rate of the blood flow will be really high there. No? Still no? Okay, I will try to make it slight and use the river analogy. So for this we need to talk about cross-sectional area. Your systemic circuit starts with just one vessel, right? It's aorta. It is large, no doubt about that. Diameter is pretty big. Are you with me? So you have certain area, cross-sectional area of the aorta. Make sense? Then it starts branching. The branches of the aorta. So it starts like it goes like that's the cross-sectional area. It starts branching. So the cross-sectional area becomes a little bit more, bigger. Okay? And then it gets into the arterioles, and it's still, like a little bigger. So you're talking about pushing a lot of blood into a relatively narrow vessel. Does that make sense? If you think about the river, when there's a lot of water goes into a narrow stream, it is really fast. Does that make sense?
But also has high resistance?
Oh yeah. Yeah. Again, here's the deal. I think I found it. So imagine you have a plateau up in the mountains, and you have stream that wide on the plateau, and it goes fast. And then this plateau goes into the steep hill, into the ravine, okay? This stream will be much faster on that ravine, so that's the pressure difference. It goes really fast. And then suddenly, at the bottom of the ravine, you not only have vast expansion of the cross-sectional area, but the pressure gradient is also low. So you go from the steep falling of the water on that steep of the ravine, you're going to the really wide river bed, so to say. Does that make sense? Those are capillaries. cross-sectional area of all the capillaries is enormous. So you go from relatively small area in arterioles to massive cross-sectional area in the capillaries. Does that make sense? And that makes the blood flow in the capillaries very slow. Are you following me? Does that make sense?
Why does it make the blood flow slow in the capillaries?
Imagine that water in the river that goes from a narrow riverbed to a really wide one.
Okay.
Does that make sense? Like in Cuyahoga River, if you go down to, in like Akron area, I mean, it's relatively fast. You go closer to Cleveland when it becomes wider, it is really a slow river there. Does that make sense? And then, despite the very not steep gradient of pressures in the veins, since in veins you have a decrease in cross-sectional area, actually blood flow kind of picks up. So blood flow is fastest in arterioles, I mean the rate, okay? Then it becomes the slowest in capillaries. And in the veins, it is slow-ish, but not as slow as in the capillaries. Does that make sense to you? What I really, really want you to appreciate and like fundamentally, qualitatively, blood always flows from high pressure to low pressure. Does that make sense? Okay? Now, we figured out this one. So for when heart pushes the blood into the aorta, we're talking about systemic circuit only, okay? When heart pushes blood in the aorta, I mean, it's relatively easy for it to flow through the arteries, they really low resistance vessels, until it hits arterioles, then it's a different story. Then in capillaries, it's really slow. And then we end up with veins. So we basically, if you think about it, we have two sets of veins, so to say. Veins that drain the upper body, like your head, your torso, and your arms, right? And getting blood from those things is not a big deal, because it's for the heart, it's kind of harder to push it up against the gravity. Does that make sense? And then blood will just drain down. It's easy. Now, the problem is with the lower body, right? To get blood back through these veins from your legs, so to say, and not so to say, legs and abdomen to the heart through the inferior vena cava. Are you with me on this one? So how do you do that? Like, what helps blood to get there? Muscular pump that we already mentioned, right? This is why if you sit like in a plane for an extended period of time and you're not moving around, blood becomes stagnant in your legs and your feet. And when blood doesn't move, it increases the chances for thrombotic event. Okay? Formation of a clot. So, muscular pump, respiratory pump, and valves. Your veins have valves that look like this. Okay? So, wait, no, the other way around. Well, I can use this again. When blood goes this way, if it kind of tries to go back, this flaps will close. Does that make sense? So that go ahead.
Are we talking about legs right now?
Any. In any veins, you have valves. Does that make sense? Make sense? Now, are you familiar with varicose veins? Like you. Where are they formed mostly? Legs, yes. This is why. When, when you're not particularly active, when your work is sedentary, right? Blood pools in your legs, okay? That increases that load on the valve. So imagine I'm gonna redraw this. Okay, so blood should go up in the vein. right? When you are sitting, it's really hard for it to get up. So these valves are constantly kind of preventing it from backflow. Make sense? They work extra shift. Eventually they become dysfunctional. When they become dysfunctional, it increases, the pooling of blood in the veins, stretches them out, varicose veins. Make sense?
So when we're sitting down, the flap is tries
When
to
we-
close.
When we're sitting down, it works harder, basically. Because look, I am walking around here. My job is not sedentary. That makes sense? I'm walking around. So muscles in my legs contracting. When they contract, they form muscular pump, which squeezes blood pretty actively upwards. Does that make sense? Clear?
So that's why, like, when you sit down, people say, like, oh, my leg fell asleep.
Oh, that's a nervous problem.
Uh,
And they sit on the nerve. Okay, that makes sense. Good. Okay, so we figured out how blood pressure is maintained in those blood vessels. Okay, cross-sectional area. We figured the highest cross-sectional area is for capillaries, and the slowest blood flow is in the capillaries. Now, here's another thing. Few words just about blood pressure. So you know systolic, diastolic, right? So systolic pressure is during ventricular systole, diastolic during ventricular diastole. I'm gonna do like very dashed story, right? Normal is considered 120/70. Hypertension is 130/90 and above. I think I'm not gonna ask this number, so don't worry. Like hypertension is something like 100/60, although no, it should be lower than that. Now, here's the thing. Is lower blood pressure beneficial? The short answer is yes. So if your blood pressure is 110/65, you're in a good shape. Okay, it's better. It's better. Does it warrant to take like drugs to reduce blood pressure? No, it does not. Makes sense so far, right? When you measure here, first, when you listen to this first sounds, so-called Kortkov sounds. So basically what you do, you're familiar with blood pressure measurements. Are you familiar with the mechanism, how it works? When you pump the cuff, initially it blocks all blood flow through the brachial artery. Then you start releasing pressure, and first only systolic pressure comes through, okay? And you hear those Kortkov sounds. Like you put it here, boom, boom, boom. You hear those sounds until pressure in the cuff becomes lower, than diastolic. And then Kortkov sounds disappear. So when they appear, it's a systolic pressure. When they disappear, it's diastolic. Pretty straightforward. I'm not going to talk a lot about like mechanisms of hypertension. Go ahead. Question? Not going to talk about mechanisms of like why hypertension develops. It can be primary, secondary. Primary is like real hypertension. Secondary is usually due to some other like renal problems or whatever. Okay, so